My name is Chris Kellogg. Thank you very much for tuning in today, and welcome to Caregiving 101 for your parents. I've spent my entire professional life helping seniors and their adult children navigate the healthcare continuum. Our goal is to be able to help aging adults and their children have the power, control, and dignity what the elders want, and the peace of mind they and their adult children want as well. I earned my undergraduate in psychology and sociology from West Virginia Wesleyan College. Then I went on to earn my master's from Boston University with a concentration in gerontological studies. From there, I went on and I was a director of social work for a subacute and long-term care facility for 18 years. During that time, healthcare changed. Healthcare got very compartmentalized and also very siloed. We saw more and more changes with elders coming back into the system where all they wanted to do is stay independent no matter where they are. Today we're going to talk about the systems that I have learned along the way, and also programs and philosophies to be able to keep our elders home, and for us, the adult children, to have the peace of mind that we want and they would want for us. We're also a part of ELCA, which is the Aging Life Care Association. There are ELCA members throughout the United States that are the one purpose to help the seniors and the adult children navigate the challenges that come with aging. They are familiar with the 8 vital roles, which are healthcare and disability, helping people find loved ones the financial assistance that they need, managing their money, housing options, helping with the transition of family matters, local resources in the community, advocacy, helping find elder law attorneys, and also managing crisis interventions. The one unique thing about aging life care professionals is they act much like a financial fiduciary would. There is no financial benefit for them to help place you and offer suggestions. So all of the recommendations that you hear from them, they're empirical. And it's important. All of those services are essential because of the transitions and the changes. I think Betty Davis was the one that said, aging isn't for sissies. And perhaps she said it correctly, is that there are changes physically. Our cardiac status slows, our respiratory status slows. When there is an injury, our ability to recover takes longer and be able to get back to our baseline. Oftentimes, those are a result of chronic diseases. We'll talk a little bit more about that, but the hard thing about these chronic diseases that we'll talk about in a moment is that there's no cure. All we can do is be able to manage them. With that said, the key to be able to have a successful management of these diseases is early management, detection, and talking with your doctor. Some of the most common diseases, chronic diseases out there are arthritis, hypertension. In addition, there's congestive heart failure, diabetes, and cancer. Now, many people tell me that, this is just a passage of aging. And I want to say that's not true. We need to not settle. There are always going to be options for us to be able to have that independent life that we want for our loved ones and what they want for themselves. But we need to be able to come up with a plan. Don't just settle. And what is normal aging? There is no universal normal aging. Much like our physical challenges that we have, we also have cognitive ones, all of which normal aging often is the slowing of being able to have our thoughts, our judgments, having word finding. What is not normal aging is not being able to find a word, having impulsive judgment, having challenges like this. And again, if we see changes like this, don't just write it off a part of aging. Oftentimes, if we see a sudden change in our loved one, It could be because of a urinary tract infection. It could be a vitamin deficiency. It could be potentially that they're not taking the medications at the right time. Don't just settle. Ask the doctor, have a conversation, be able to have informed decisions. This is what I see. This is when I see it. This is how I see it, so that we're able to give the doctors as much clinical information as possible. The more handles we can give that physician, the better off our loved one is going to be. We hear a lot about dementia. Well, there's several different types of dementia. Dementia is an umbrella statement. There's several different underlying diagnoses. We hear a lot of, again, word finding challenges being able to complete complex tasks, sometimes forgetting where they are, what year we're in, who potentially they are, timelines of people, responsibilities of things, having irritableness, changes in personality sometimes. And these are all things that we don't just write off. Be able to track and trend and have a conversation with your doctor. An ounce of prevention is going to be worth a pound of cure. Much like other chronic diseases, there is no cure, but there is better management. And we'll talk a little bit more about how we can help our loved ones manage these. Alzheimer's is the most prevalent type of dementia out there. 60 to 80% of all dementias are based with the Alzheimer diagnosis. If your physician says your loved one has dementia, please don't just settle for that broad-based statement. If your physician's not able to tease out, diagnose, label, it's time to go to a different doctor, a neurologist potentially, a gerontologist. Go to a doctor this is really their wheelhouse, because being able to effectively label this will also give better opportunity to have the environment and their world work for them, so that we don't need to hope that they are at their highest level of functioning, but their world works and supports them in their lowest level of functioning. Right now, there are over 190,000 people living in New Jersey with Alzheimer's. And right now, there is 5.8 million people in the United States with this diagnosis. Right now, there are over 16 million loved ones being able to manage their family members with this diagnosis, being able to be there, be available, be present to try to keep them independent. If you are seeing some of the things that we've talked about here, whether it be falls from a diagnosis, forgetfulness, judgment, medication mismanagement, it's important that you go and have conversations with the doctor, because if you're seeing this, you're knocking on the door, if you're not already there, being a care provider. If you see subtle changes, let's put it in more simple forms. If you were to go downstairs in your basement, if you have one, and you see a puddle on the floor, and then you look up and there's a leaking pipe, when are you going to call the plumber? You're going to call the plumber that day. And why is that? Because you know the next time you come downstairs, if you call the plumber next week or next month, you can have water up to your ankles or up to your kneecaps. The same thing happens with our loved ones. Elders need assistance in a timely manner so that the physicians in the healthcare community, instead of offering this, they can offer this. Power, control, and dignity is key. Options are key. Most often, we don't choose to become a care provider. It's bestowed upon us. We don't plan for it. We start missing work. We start missing social events. We might start putting off our own doctor's appointments so that we have the ability, the time off, to be able to take our loved ones to the doctors. Neglecting our family role, not just mom and dad's, but also as a parent. How are we able to best provide for our children, for our spouse? We need to be able to talk about sharing responsibilities, oversights. If we are doing this now, whether it be starting to manage checkbooks, being there physically to help them in and out of the doctor's office, you are a caregiver. Don't just kick the can down the road lean into it, and let's talk how we can be effective at our role of being a caregiver, but maintaining that role of a son or daughter, and also maintaining the roles of our other responsibilities in our life. The transition from being a care receiver to a care provider is often very turbulent. For a spouse, it's changes of routines, changes of roles, and changes in our world. If it's an adult child, going from being able to talk about current events in your life and potentially talking about current events in the grandkids' life, you go over to the house and we start problem solving. You lay out medications. What is on the agenda for next week? Are they taking medications appropriately? Is there food in the house? Is the food that is in the house something that has not been there too long? We start having our to-do list. What can we do to maintain that role, to talk about our kids, to talk about potentially the game last night? There are several different things we can do. But first we need to get over the emotional roller coaster. There's a spectrum of care, from being grateful that thank goodness I'm here and knowing that my loved ones are happy that I'm here, to also us feeling overwhelmed, them resenting or even being angry that we feel impelled to do this. We need to have a mature life plan. And that is the hardest thing. Communication, conversation about this is extremely challenging. There was a survey that was done by Care.com a few years ago by over 2,000 people talking about the sandwich generation. The sandwich generation are adults caring for their aging parents and also managing the care for their younger children. That survey demonstrated over 54% of those people surveyed would rather talk about the birds and the bees to their small children than talk about their future care needs of their loved ones. It also went on to say 55% of those people polled still have no plans to actively engage in communication with their loved ones. Listen, aging isn't the end of the road, but it's a bend in the road. It's also like going on a cross-country road trip. If you don't have a map, have your mature life plan. And let's talk a little bit more about that. We need to have communication with our loved ones. What is their definition of a quality of life? If we were to take a piece of paper, write that down, all of us could have different definitions of a quality of life. What can we do for our parents to help support them maintain their power, control, dignity, and peace of mind? We need to talk about that because my definition could be very different than theirs. They are older, they are wiser, they have more life experience. But I can't support that if I don't know what that is. We need to be familiar with those 8 sections, with the resources we have, with our family, and expanding out. How can we rely on those resources to support that? By communicating, we need to stress, because if we don't talk about these loaded conversations sometimes, the stress that we will have will only amplify. We will have our own medical challenges, high blood pressure, stress. We can go down the list. It was a Stanford study about 10 years ago that researched people that were a primary caregiver for their loved ones that had Alzheimer's disease for over 10 years. 62% of those people polled passed away before the people that they were caring for. And why is that? It's because of the stress. They are putting their loved ones first, then putting themselves way in the back, going to their doctor's appointments, not going to your own doctor's appointments, resources, finances, going to medication, making sure that they have the best food, not having time to have self-maintenance. The one thing that's going to beat being a wonderful caregiver, a wonderful son, a spouse, a nephew, is that we're human. All of us have that magic threshold, is that once we hit that, it's awfully hard to come back to earth, have that plan in place so that we can support. Okay, how do we do this? We need to have the same rule that we have when we go on the airplane. What do we always do with the stewardesses or stewards are in front? You gotta put the oxygen on yourself first. You need to make time for yourself. You need to identify what the stressors are. What are the things I can fix? What are the things that are out of my control? Having me time is not weakness. You need to have self-control to do something that brings you joy, that helps you go offline. Exercise, taking a walk, taking a bath, sitting and reading a book, so that you have something to recharge your own battery. This is vitally important. Don't just pick on yourself that I should have done more, I could have done more. Gosh darn it, I've done a lot today. Pet yourself, because there's only one of you. Be proud of that. You're doing the best you have with the options that you have in front of you. And let's talk a little bit more about those options. Again, give me the serenity to accept the things I can't change, the courage to change the things I can, and the wisdom to know the difference between. You know, we need to not just act, we need to take a minute to breathe. And not just one breath or even 3 breaths. We need to take 5 deep breaths, in through the nose, out through the mouth. If we do that, we will automatically change our physiology. We'll release endorphins immediately. Take time, focus. If you're actively engaged with a hard conversation with your loved one, there's nothing wrong to say, I need to step out for a minute and go around, regroup. If you're feeling your thermometer getting hot, emotion is a real thing. We need to be able to have constructive conversations with our loved ones. If you're in a relationship with your husband or significant other, talk to them. What are they comfortable in doing? What aren't they comfortable in doing? Maintain those roles. Go out for date night. Ask what their opinions are. What is important? And again, what can't they do? What are those perimeters so that they feel that they are your partner? So you have a united front. Talking it over with the family. Again, there's going to be juggling. There are going to be fire drills, but being honest, especially with children, it's not uncommon that I hear myself say, boy, with 2 teenagers, you talk a little bit louder than you think you do. Guess what? It doesn't skip generations, so do we. They are going to know that there's something going on. If they say, what's going on with grandma? What's going on with grandpa? Don't just say, no, they're fine, everything's good. They're going to know. Lean into it. Say, identify at an age-appropriate level what is going on. Many hands make light work. When you feel like you're a part of the team, you're able to hold each other up. What can they do to contribute? They love the artwork. When they go over to grandma's house and you're talking to grandma, can they take the garbage out for you? Delegate certain things that they can do to be a part of that team. Have the conversation with your loved one. Don't wait for a holiday. Sitting down at Thanksgiving dinner is not the right time. Sitting down and pouring a large glass of wine is not the right path. Being able to have conversations and be a wordsmith. I tell people it's very important to be able to talk about what are our 3 most important things. What are the things that concern you? Do not use the word you. Use the word I. I am concerned because of this. It could go on and there could be challenges. If you say you took the car out and you got into an accident, you're not taking your medications correctly. you're wearing the same clothing that you had the last 2 times. You are projecting. We're human, we're going to have a knee-jerk reaction to go back at them. We are entitled to our own opinions and our own concerns. Start with the word I. Being able to have these conversations ahead of time before you're in crisis. What is that definition of the quality of life? Sometimes that's hard to generate. Having tools out there like the 5 wishes, that these are the things I don't want to have happen to me. Having the conversation about the COIL, conversation of your life, that's through the New Jersey Quality Institute. Backing in versus going forward oftentimes makes sense because we don't want to have these hard conversations in crisis. This is the aging life care continuum. Having these conversations after a change of status in the emergency room is not the appropriate time. Emotion and common sense don't play well together. We need to be able to anticipate our loved one's lowest level of functioning and be able to talk about what can we do to build up in the environment that they are in. What is going to be that threshold that the environment that they are in now isn't going to be safe? What things can we do to support them in that environment? Adaptive devices, technology, potentially home care, make their environment work for you at their lowest and then build up backwards. Have a plan A, have a plan B, have a plan C, because once you're in it, time is of the essence, and that's going to be a challenge. It's human nature to look at a challenge and say, oh my goodness. We need to stop and pause and look and chip away at small pieces. And again, give yourself credit when credit is due. Most of us want to be able to help our family members that are going through change. What we need to be able to do is don't be afraid to ask them. Don't be afraid to accept that assistance. Again, what can they do to help you? Can they take out the garbage? Can they take care of the recycling? Can somebody bring over a meal? Aunt Susan's gonna get the meal on Monday night. Aunt Beth is gonna take the meal on Tuesday. Divide and conquer. What sort of services are in the community to be able to reach out? Talking further about all we want is to have that independence. Pull all of our vital information in immediately. Start a communication kit, a 3-ring binder, being able to have any type of advanced directives that you speak to an elder law attorney, your living will, your health proxy. If there's a POLST involved, practitioner's order for life-sustaining treatment, don't have these things locked up in a safety deposit box. People that are in your world, all of your doctors, their addresses, their phone numbers. What diagnoses are we aware that you have? What allergies do you have? What medications are you currently on? When you go to doctor's appointments, make sure that you bring that and update that regularly so that we are all familiar with this. AARP on their website has a wonderful program out there that you can fill in a lot of blanks on those. Again, being able to come up with these conversations so that you have your triad of care, someone navigating you, having your finances in order, knowing what you have, a conversation about money to be able to support where you want to be now and for the future. Having your legal documents in place is the triad that you need to have. And finally, it's not uncommon I hear, boy, this plan sounds expensive. Well, it's not cheap, but studies have also showed that people have gone through this. Those that have not, their adult children feel that they would have been able to save $8,000 to $10,000 if they had made those arrangements ahead of time by talking about this. So time wasn't needing to be scrambled to get T's crossed and I's dotted. And furthermore, that those caregivers felt by 60% that their parents should have had that conversation. If you see those changes, initiate. Have the I conversation. Pull your information together. Have your aging life care professional. Talk to clergy. Work with the Office on Aging. There are many different resources out there that can help you be familiar with those 8 stages and 8 different disciplines so that your loved one has their power, control, dignity, and peace of mind. Thank you very much.